So as we've discussed, this is a very intense and aggressive treatment. It's going to be quite debilitating for you over the next few months. I know that you must have some concerns about your work, and I wonder what concerns you the most at this point, and if there are any questions you might have that I could help clarify for you as you're planning your life over the next few months.
I do have a full load of classes, and I'm also trying to finish a book.
Mm-hmm.
I don't want to be a burden on my children. My wife is out of the picture, but I have been seeing some people. Should I plan on staying in some kind of facility would take care of me, or have some kind of nursing service? Will I be laid up?
These are very good questions. To a certain extent, you will be laid up. There will be weeks when you're really quite ill. I think if there were a way for you to get out of some of your responsibilities at work over the next few months, I don't know if there are options to have substitutes come in and cover classes for you temporarily.
Well, I could, if there was sick leave, and I'll have my insurance, so I'm sure the school will back me up.
I think that would be a good idea to go ahead and take sick leave at least over the next 2 to 3 months. You may have days when you feel well enough to work on your book, and so hopefully you can feel good about having a little bit of continued productivity, but I wouldn't push yourself.
And there's nothing contagious about any of this?
Absolutely not.
Spreading this to me.
So you don't need to worry. It would be wonderful for you to spend time with your children, and in terms of your relationships, it's really a judgment call about how much you want to involve other people, but I think your concern about not wanting to burden the other people in your life is very understandable, and to that end it might be helpful to have, for us to help you set up a visiting nurse during the tough parts of the therapy.
That's available.
So that you don't have to necessarily rely on your children or girlfriends, etc.
Yeah, good.
Do you have any questions about any of this that we've discussed and how this might affect your life, your work, your relationships?
My appearance will change dramatically. Will I lose weight? Will I be...
Very good question. I wouldn't say your appearance will change dramatically, but you certainly will lose weight. You probably will lose, I would guess, in the ballpark of 20 or maybe even 30 pounds. And that is the main difference in your appearance, is that you'll lose weight, and also you'll get some skin changes around your neck that may not be quite as noticeable. But I don't think you'll lose your hair, and so you may not look necessarily like a cancer patient, but you also may not look quite like yourself when you're going through this.